In the 12th century, when Europe still relied on superstition to treat illness and surgeons feared opening the human body, one physician in Al-Andalus was rewriting the laws of medicine. His name was Ibn Zuhr, known in the West as Avenzoar, and he became one of the greatest clinical doctors of the medieval world. Born in Seville to a family of physicians, Ibn Zuhr inherited knowledge that spanned generations. But he didn't just repeat what his ancestors taught. He challenged everything. He believed medicine wasn't about reciting theories. It was about direct observation, clinical practice, and evidence. While others built medicine on philosophy, Ibn Zuhr built it on the patient's body. He performed some of the earliest recorded tracheotomies, daring to operate on the throat to save patients who could not breathe. He described pericarditis, pulmonary abscess, liver diseases, and parasites with detail far beyond his era. He documented how to test for scabies by removing the worm itself, a method still recognized in modern dermatology. He didn't rely on guesswork. He relied on experimentation. He dissected animals to study conditions safely before attempting procedures on humans, a clinical approach that Europe would not adopt for centuries. And unlike many physicians of the time, Ibn Zuhr rejected the idea that illness was caused by demons or curses. He wrote that disease must be understood through the body's structure, diet, environment, and lifestyle. To him, medicine was an exact science, one that demanded courage, precision, and a willingness to challenge tradition. His greatest work, the Book of Simplification, became one of the most influential medical books of the Middle Ages. Inside, he described early techniques for feeding patients through tubes, treating fractures, diagnosing cancer, and preventing infections. His methods spread across the Islamic world and later into Europe, where he shaped medical schools for centuries. Ibn Zuhr wasn't just a doctor. He was a reformer. He criticized treatments that had no evidence. He exposed dangerous assumptions. He insisted that every physician must test, verify, and observe with clarity. In an age when many thought surgery was barbaric, he proved that careful scientific intervention could save lives. In an era of fear, he brought logic. In a world of theory, he brought practice. His legacy influenced generations of doctors, including his close friend, the philosopher Ibn Rushd. Together, they helped create one of the greatest medical cultures of the medieval world. Today, Ibn Zuhr is remembered not just as a physician, but as one of the earliest true clinical scientists, a pioneer who bridged experimentation, surgery, and critical thinking, a man who refused to accept the limits of his time and expanded the boundaries